circumstances, you've been able to ride the storm through. So you can congratulate yourself for the great success you've had. And again, just thank you for having us here today. So I'm going to hand it over to the experts from here. Appreciate it.
Thanks, Ted. And again, I want to thank all of our vendors that are here today. We definitely could not put this on without you. So thank you all for sticking it out with us today. I know that we are the last session between alcohol, so we are going to hopefully make it fun up here, and then we can all go have some drinks and hors d'oeuvres in the North Point Ballroom. So I'm joined here on the stage today. Well, I guess I'm Christine Tubble, the Director of Advocacy here at OPRA, and I am joined with Rachel Hayes, Mike Toman, Anthony Aquillo, and my boss, Pete Moore. So we're going to just go ahead, dive right in with some legislative updates, and then we're going to transition. Oh, are we?
Get out of here.
We good? Okay, we're going to just dive in very briefly into some of the vaccine mandate stuff. Obviously, we were not intending to cover that today, but our partners in the federal government had other ideas for us today. So we're just going to go ahead and get right into it with some political state house updates from Anthony and Mike. So,
Want me to go?
I'll let Anthony start.
Well, good afternoon, everyone. Anthony Aquillo with the Success Group. I appreciate you all having us here today. It's great to be doing these again in person. So great to see everybody. I know we don't have a lot of time, so really just jump right into a political update or just an update really on the big ticket items politically as well as policy-wise that are currently going on at the State House. And to start really politically, I think to provide good context of what's going on is the House Speaker race. Current Speaker Bob Cupp is term limited going into the end of next year. And it provides some important context because really, you're going to start to see members vying for that leadership spot. And we were recently talking with a House representative who, since he's been in Columbus and since 2015, has had 6 different speakers in his tenure. And I think really with current Speaker Bob Cupp following the turmoil of last General Assembly and him taking over, I think the legislature, particularly the House, really looked to him to kind of right the ship and get that caucus moving in the right direction. I note that because when you go through leadership changes, caucus priorities shift each time. Oftentimes you have chair positions that switch and there are power struggles, and really the legislative agenda is never for certain. I think in our space, we were very fortunate during the budget, which just wrapped up in June, as it relates to the DD space, that Speaker Cupp really instituted and rostered a subcommittee with folks that really have been champions for our space, really are knowledgeable about the work that we do. Rep. Romer, who chaired the subcommittee, was around last General Assembly and worked closely with us. Representative Scott Lips, who is also the House Health Chair, has always been, has been an advocate for us. So it really to have that knowledge and foundational, institutional knowledge as we were entering the budget process was really important for us. But these roles are all, are always subject to change when you have a new speaker come in. Finishing out 2022, I think, it could often become more contentious. You have representatives that will often team up, promises are made and folks start to align with one another. And those chairs who were there last General Assembly, last budget cycle, aren't always guaranteed to be there, in the next turn. So I guess on that end, I'll see if Mike, if you have any additions to that.
Yeah, first of all, it's great to see everyone and be back in person. I've represented you for 21 years. Started at the Success Group 21 years ago, and always appreciate your confidence and trust in us. And I'm honored to represent you. It's been the last couple of years. I can't imagine how hard it's been for you all. I know we've heard about your workforce struggles. We spend a lot of time talking to the board and of course, Pete and Christine and the rest of the team. And I feel really privileged to be able to represent you and the work that you do and the services you provide and helping people. So thank you for that, and thank you for what you do. Just to sort of tag team on what Anthony said, how this is in sort of context with, our system is, since COVID's hit, the speakership race already sort of got started right after the budget. And we did that budget, obviously during the pandemic. But since then, we have 4 or 5 people running for speaker. A couple of our members that have been really helpful to us, we've only got one more budget with them. So to put it in context, we've got to sort of draft a new champion, a bunch of new champions. Now we've also got some help in the Senate. We also may lose Senator Romanchuk over there, who's been very, very helpful. So, the speaker's race, leadership changes are really relevant to us because it means that we've got to sort of build the team back up again and work with new members and create new champions. I'm always a big believer in making sure we answer your questions. I want to make sure we get into those. So I don't want to belabor what's going on too much. Just two notes. Obviously, we had the election yesterday. Obviously, the statewide elections will be next year. The entire House will be up next year. Half the Senate will be up next year. We did have 2 special elections, congressional elections. They went the way we thought they would go. Up in Cleveland, Chantel Brown is going to be the new Congresswoman up there, Democratic member. And then down here, it'll be Mike Carey in the Columbus area that will replace Steve Stivers. Both, pretty heavy Republican index in the Columbus /Southeastern district of the 15th. And then in the Cleveland area, pretty heavy Democratic district. So they kind of went the way we thought they would go. So school board races, and that's relevant a little bit because at the State House, we've spent a lot of time this last year. And I told one of the speaker candidates the other day, he came in and talked to us about fundraising. And I said, look, you guys are talking about critical race theory. You're talking about transgender sports and bathrooms. You're spending time on COVID and anti-mask, anti-vaccine issues. Those are issues that some people care about, some people don't. But we really ought to be talking about workforce and the problems that everyone's facing on workforce, and that is something I hope that we can still get back to. We also have a redistricting fight going on, obviously, at the State House. So I'll stop there with what's going on at the State House, and we'll sort of dive into sort of more system-related issues, depending on whether Pete, Christine have something to sort of jump into. So as far as our system-related issues, I mean, obviously, I think and I'll also say, we don't lobby the Biden administration, although we do help with our congressional members and the U.S. Senate members at times. We mostly do the State House and the DeWine administration right now. And so, but obviously we've helped try to communicate our concern with what the decision was today. So we have that going on at the backdrop. At the Ohio House, obviously we have sort of the opposite. We have about 20 or 30 anti-vaccine bills, or some of them are, some of them are all vaccines, some of them are just COVID vaccine. And we've talked a lot about how that impacts our system. So we've been doing that, and obviously also spending a lot of time on our workforce issues. What I think we'll have yet this session before they wrap up in December is many of you probably saw the home and community-based service ask of CMS. That's about $900 million, almost $1 billion. Not all of it is going to us, of course. And not all of it is going exactly the way we would like it to go in terms of the way we would necessarily construct it. But there's about $900 million there, and a lot of it is going to touch our system. So we've got some work to do there. I know we're still working on the details. The details are vague. We want to row with the administration, not row against them. So we are working with them to find out more details and work with them on how that comes together. Separately, there's still about $800 million that the administration and the General Assembly has to get out before the end of the year of our ARPA dollars. There may be some opportunities there for us too. That remains to be seen, and we are communicating with the lawmakers and the two chambers on that. Another $2.5 billion has to be released next year. And for better or worse, we've not spent a lot of time on capital bills over the years. Some of you have, because you've had capital asks, but as an association, we haven't spent a lot of time on that. But generally speaking, those bills are sort of put together by the General Assembly and the administration before they're introduced. And so by and large part, those ARPA dollars are going to be put in place before we introduce the bill. So we've got a lot of work behind the scenes to do yet before those bills get introduced. But we think that that's primarily what we're going to be working on yet the rest of this year. And I'll stop there and start getting into questions and, see if you have questions and so forth.
I guess, Mike, could you speak a little bit about, I think, how all of this ties together? With the vaccine mandates dropping today, how is that going to impact timeline of some of this stuff as the GA tries to navigate through some of these cultural issues, vaccine mandates, speaker races? What's your kind of read on this? Anthony, please chime in.
Yeah, so I'll start. Obviously the vaccine mandate is still pretty fresh as it happening today. We knew it was coming. We made our case to the administration. They've kind of made our case too, to the DeWine administration. We made our case to the DeWine administration. They made our case also to the Biden administration. We expressed our concerns with the Senate, our senators. They still moved forward. They know sort of where we are. I expect these things to go to court quickly, and that, we'll see how, I don't know how that's going to go yet. So I really don't know the answer on timeline. I saw the Attorney General was already looking to sue. I expect other folks to do that. Obviously we know if restaurants can't fill the workforce, then, people can't go to the favorite restaurant. If we can't fill the workforce, then people can die. And I think that that's, a message that's going to hit home quick if they don't do something about what they just did today. We've expressed that. It's frustrating that, we didn't get some exceptions there. I understand what they're trying to do. But in terms of timeline, at the State House, we're mostly working on the COVID-related vaccine bills and mask bills there. I don't think those are, even though there's a lot of them, there's a lot of pushback on those, and there are people sort of on both sides of it that kind of prevent a majority of votes from one of the bills being passed. So I think that those aren't probably going to get done, and you'll see people instead, probably position themselves to sort of go after the Biden administration's proposal here. So I don't know. That doesn't really answer your question, but I answered part of it, I think.
Yeah, and I would just echo in terms of in the General Assembly, I think we've already seen the House Speaker kind of shut down some of the mask and COVID related bills. I think timeline looking into next year, I think there's going to be a strong push, especially if there's a large package of ARPA dollars. Honestly, some of these members may have pretty tough primary races in the big election year. So maybe we come into 2022, we get a large package done. That's something they can run on back home in their districts, and there'll be an incentive to want to get something done. But I think the energy regarding redistricting, once that wraps up, I think that energy's got to be diverted elsewhere, and hopefully, optimistically, I hope they become a little more productive on other issues.
Okay. I think one thing too we've talked internally about, and I think on many of our Friday fives, we know that the ARPA dollars that we've been discussing a lot have been specifically for HCBS programs. I think part of this other ARPA pot of money that's not explicitly tied to Medicaid is where we're going to try and look to find some support for ICFs. So that'll also be on our list of goals that we're going to work towards for the next few months.
This has, but the ICF piece, as you who operate ICFs know, have been excluded from the HCBS ARPA fund. So as Christine just said, we have had very specific recommendations to our partners about we must include ICFs. And we're also working on some letters to legislators about this and speaking to that very specifically. So just want to reassure that even though it's not included in the much talked about HCBS piece, there's definitely money out there, as Mike alluded to, that can cover relief funds for ICFs, and definitely a priority for us.
I'd love to do questions. If we have questions. If not, we can keep sort of talking about the legislature if you want.
So any questions? We can.
I mean, the thing that I would add is, I mean, you know, we're not in an election year, but because, you know, because folks are sort of just now, you know, maybe not in all your regions, but people are kind of getting out and about again, right? And I think it's an opportunity to try to touch base with lawmakers that you may or may not have met when they won last year because of COVID. You know, last year, there were a lot of lawmakers that came to town. We met most of them virtually. And now we've since been able to meet most of them live. And I would say to you all that if you have a relationship or you have an opportunity to have a relationship, please get out there and introduce yourself to those folks. As I said earlier, alluded to earlier, we need new champions, and we've got some great members that want to help us. But the thing that happens to us every couple of years when 30, 40 new members, the turnover, 30, 40 new members come to town, is that we've got to develop those relationships and help educate them in our space. Our space is complicated. All Medicaid spaces are sort of complicated, but we don't need you to try to explain to them our system as much as just tell them who you are. And so I would just encourage you all to get out and introduce yourself to some of those folks. Most of your lawmakers are pretty willing to get out and about now in the community and aren't just doing things virtually. So I know that's not the case for all of you, but I think that's something we should try to do. I talked to the board about a month ago. We had a meeting with the board and other members of OPRA, and as much as we can, we need to keep working. And I know you do this back at home, but we need to keep working with our boards and our family, our families to row together and come up with proposals and work together as much as possible at the State House. One of the advantages that we've had the last couple of budgets, and even though we don't always get what we want, we've gotten more than most providers, nursing homes being the exception. We've done very well the last couple of budgets. Again, it's not perfect, but we've done well. And it's because of our good work, our champions, and the fact that we've been able to work together with the rest of our brothers and sisters in the family and the system. So I say that, I know we got some reform efforts we want to work on. We've obviously have the DSP issues and obviously some ICF issues we've got to work through on the ARPA piece. But I think that's kind of the last I'll say about sort of the system. And if we could talk more about your questions or General Assembly, I'm happy to do that. Oh, I'm sorry. Kyle.
How long do we have to wear a mask for? And most people are tired of it.
You guys know? The question was, how long do we have to wear a mask for?
Oh.
We're very tired of it. Yeah.
It's a great question. I have no idea. It's interesting because when we first started at the State House, most people aren't wearing masks. And depending on where you go in the community, some people are wearing masks, some people aren't. I still wear one at the State House. I have a 7-year-old at home trying to keep her in school, regardless of how you feel about masks or vaccines. What I've said to lawmakers, I'm like, look, I don't want 10 days, like my child being home for 10 days. So I try to still wear one, but I know that a lot of people are tired of them. I'm tired of them. But I don't know how long the mandates are going to be put in place. It honestly depends on where you're at in the state. City of Columbus still has the mandate. A lot of other places in the state do not. So schools do, obviously. Jamie.
It appears to me that with this mandate that came down today, that we should have some kind of mechanism to funnel up how many staff we've lost because of it. And just add it on to our numbers that we hopefully we have. But so is that something you think would be a helpful for OPRA to collect? And so that's it.
You know, data is always helpful. I mean, I feel like a lot of data and facts get lost in the politics right now. I mean, I'm just being honest. You know, the red states aren't talking to, you know, the blue administration, you know, in DC. So it is. Yeah, I think so. Yeah, I think we should, you know, I think we need the data, and I think we need to get, you know, keep getting it to particularly our US senators and congressional members. You know, the members of the State House, the members of the Ohio General Assembly they can send letters, or, you know, they can send resolutions and so forth to Congress, but we really need, on this, we need the president and our US senators to help us. I know that the Ohio Chamber, you know, kind of, you know, they basically had the same message that we had, was that, you know, keep government out of, you know, both at the State House and at US Capitol, keep government out of this and let employers handle it. If you want to have a mandate in your shop, then so be it. If you don't, then because you can't, then it'll work itself out. And I think that's sort of, you know, that's sort of the message the chamber had. Obviously, I know that, you know, obviously it wasn't heard, if you will. In the back.
Hi, Mike or Anthony. Probably an ICF specific question. So obviously, I know we had a little bit of a win in the first budget, but this biennium coming up is a cap and a rollback. With the emergency in the workforce, what do you think the chances are? No, typically we don't have much success trying to flip a budget change in the middle of a budget, but with the crisis we're facing and the mandates, is this worth our time and effort to be lobbying to try to get an increase, get the cap and rollback eliminated? And as wages continue to rise, if we don't see something like that, we're going to be left behind the 8 ball. So what are the chances of being able to accomplish something like that in the middle of a budget cycle?
Got any easy questions?
Braves fan or a
You know, I don't know is the answer. I mean, I like to say, I think because they're opening up the budget, if you will, for ARPA dollars, that there's an opportunity for that conversation. But we don't know exactly where they're at yet on it, and you know, we were with a bunch of members last week, and there's just been so many other things being talked about. The administration and the General Assembly have not necessarily got their ducks in a row on the ARPA piece, you know, and therefore it's hard to know where the vehicle, what vehicle, if there's going to be a bill with that, you know, when that bill is going to get put in place to look at other things like the last budget. But we're going to try.
Yeah, to your question, Kurt, I did talk to Senator Romanchuk. We're having a meeting on Tuesday, and I asked him that specific question. So we're going to try to give him at least a little hint of what a language could look like. And to Mike's point, there is that window with the ARPA dollar. So he's been a champion specifically for ICFs, as you know, that I think if there's a chance of it happening, it's going to be through him. That's my feeling, at least initially. But when I asked him very specifically about that piece, he wants to see some language of what it could look like and process. So we have talked very specifically about your question.
kind of skated over the Senate a little bit. And one of the things I would just say, President Huffman was very, and Senator Romachuk I brought up, they were very helpful in helping us with the budget. And, there's not going to be as much turnover over there. And so we have some consistency in leadership, and they are aware of our situation. And the ICF side, probably a little bit better than some of the House members. We've got obviously champions on the House side that know our issue well, but so I want to give them some accolades that they do know our issue well, and hopefully we can get some support over there from leadership too.
I just wanted to get some clarification on the vaccination mandate. So we're a day program. We have more than 100 staff. We bill Medicaid for an income. So does that mean that everyone has to be vaccinated? And those staff who are not vaccinated need to be tested? And it's on our dime and our time?
Answer those questions here in a second. Yep.
Sounds like a good transition.
Anybody, any more questions for Mike and Anthony or Pete? I know we did briefly just want to talk. Okay, good.
I was just curious what the data you have. I haven't heard it before on the DSP workforce crisis is. What are the real numbers? What does it look like? And how does it compare to the other similar fields where it really is a life or death issue?
I don't have the numbers memorized. I know we had put some percentages together during the budget, and I've forgotten more than I remember on the exact numbers. But what I'll say is, we've been talking about the workforce issue forever, and obviously, particularly the wage piece of it. I know Pete and Christine probably have the numbers better memorized than I do, but what I'll say about it is that, the problem that we have now is that we're one of, everyone's got a workforce problem now. And so, everybody's saying us too. And that makes it really hard, because now we're asking for people. Now we're asking members to, give us an increase here, and knowing that could take from the restaurant industry or other industries, sectors that are also have workforce problems. So we're kind of running into some roadblocks with some members that are like, we're a little leery of putting a bunch of money over here, and that's going to affect the private sector over here as well. And so we now are, I think, sort of competing with, urgency, if you will. Maybe they have the numbers better memorized than I do, but.
Well, I think the problem with the numbers is they're changing every day. The numbers we had during the budget in June are completely different than what they are now. And this gets to Jamie's point. I mean, I know Jamie and I have talked about this. We almost need a sample of providers who feed data into a system on almost a bi-weekly basis, keeping it updated, keeping it current, almost like a ticker, on our website. Because we have a horrible time in our system collecting good data, and we have to get so much better at it. But I do think, to Jamie's point, to your point, Susan, is we have to come up with a way, either through DODD or through the county boards, to have a regular flow of data. We did these hotspots. You've heard me talk about this on Friday calls, so I apologize for repeating, but we did these hotspot visits and had data, and it's irrelevant now. It really is. I was talking to someone earlier. They hired 10 people, which is great, but lost 16. So we have to figure out a better way to do this. And one more comment to build on what Mike said, and we can move on to the mandates. We have to rework our strategy for budget, and we have had very intentional discussions about this, about partnering with people receiving services and their families. We've had discussions with our champions at the legislature about this, and from what I've heard, they're in agreement. That even Senator Romanchuk says they're tired of hearing it from you, Pete. We're tired of hearing from you. you got to bring a parent with you or someone receiving the services saying, we need these resources and here's why. So, and we'll be standing behind them, supporting them. So we are going to be very intentional about, in our advocacy army efforts starting in January, about partnering provider with family and people receiving services to ensure that we have a consistent message, that we're all moving in the same direction. So that is going to be our strategy, along with whatever data we can get. There is an effort with the wage verification survey that was sent out. We did get some data about turnover, but again, that was taken a few months ago and is already obsolete. So
The last thing I'll say, I know we're going to talk mandate, but I'll just invite anybody that if you want to get to know your lawmaker, and obviously, you can talk to Pete and Christine, but if you need any help, you can call Anthony or I will help you. If you want to come down to the State House and do a meeting with them, we'll help you. We'll help you set something up back at home. We're available, whenever you want to do something with your local lawmaker. So that invitation always stands. And again, I just appreciate so much what you do and all the hard work that I know you have ahead of you. And hopefully we can try to figure out how to fix the vaccine situation. Mandate.
Yeah,
go ahead.
I was trying to, I work for 2 lawmakers in the Senate, and like Pete kind of said earlier, there's a difference between us coming in and doing a site visit in the district, especially in a compelling space like this. Like, members often will take ownership over someone who's in their own backyard. They feel like they can see those results and actually have an impact back home. So yeah, please reach out. Always happy to set up a visit or an introduction just to get to know. I know it's intimidating, but certainly happy to help set that up.
And what's powerful is, I don't know where Dennis Grant is, but when we meet with folks like Senator Antoni or Representative Lips, they talk about Dennis Grant very specifically. So he has made that impact, and that helps tremendously. Because he tells the story and that we can't really tell as well. So, and before we get into the mandates, I just want to make a statement. We've talked to the vaccine mandates. I talked to the director. I talked to Brad Singer just a little bit ago. We're combing through hundreds of pages of documents, right? And I want to really thank Christine and Rachel for combing through these documents today to try to find out as much as they can so we can keep you informed. But there's still a lot to learn. So this is the disclaimer, right? Chips will make you fat, right? This is the disclaimer that we're going to give you as much as we know, but we're still combing through. We need a little more time. We are looking at having a town hall Tuesday, next Tuesday, to go more thoroughly across it. By then we may know more about lawsuits or whatever else is going on. We'll maybe have a better idea of where DODD is at with it, and so on and so forth. So I just want to say that, I want to say thank you to Christine and Rachel, but also we still have a lot to learn, and it's always open to interpretation, right? So.
Thank you, Mike and Anthony. Thanks, boss. Well, again, I'll just repeat that there were about 700 pages of regulation that the federal government dropped this morning at about 8:45. We did joke last week. We thought it would be really funny if the federal government dropped it Thursday morning.
So
Not-
it's our fault because we put it into the universe.
Yeah, we spoke it into existence. So sorry, everybody. So I think we'll start with the OSHA mandate first. So that's some of the questions that we've received already. So again, very high level. We're going to go into more detail on Tuesday. And I know that our partners at Voorhees, Suzanne is here. Hi, Suzanne. Thank you for coming today. They are also going through it. Robin is combing through a lot of the data. So I'm sure that we'll have some good information for you all, hopefully pretty soon. So OSHA, as we know, this is the vaccine mandate that is for employers that have over 100 employees. From what we've seen so far, we do believe that is 100 people on your payroll. It is not necessarily FTE. I think that that's probably an important distinction because I think it will probably scoop in more of you that are vocab providers that pay people you support. I think that will unfortunately scoop in more of you. If you had been doing some of those calculations based off of just your DSPs, frontline supervisors, admin staff, we do believe that it's going to scoop in every person on your payroll. The mandate does allow for a testing exception, and Judith, your question about who pays for that, there's no requirement that the employer pay for that. So that will have to be a policy decision that all of you take on. Obviously, there are pros and cons to both. You taking on that cost or requiring your employee to do that. Lots of HR things to consider about how you're going to manage those relationships with people that don't want to get vaccinated. There are some other exceptions / accommodations, and that process is going to follow what the EEOC put out, I think 2 weeks ago, a week and a half ago. So if you've gone through some of that information, I think OSHA is going to look to see if they come in that you're following those guidances on the accommodations. I think we've got to do some more digging into what kind of fines will come out of this, how OSHA is going to calculate this. I think they're taking it pretty seriously, so the fines I think will be fairly substantial. So we definitely going to have that as one of our top topics for our conversation next week. The effective date. So the effective dates are effective because of the way that the federal government are putting these out, are effective when they're published in the Federal Register. They're currently posted, but under an unpublished status. At least they were at 11 this morning. I don't know. Suzanne gave me the thumbs up. I think they're still unpublished. And then there's going to be kind of a slow implementation enforcement rollout. There are some dates in early December that OSHA and CMS are looking for employees to have their first shot by, and then OSHA and CMS will start to use that in their enforcement actions, surveys, starting January 4th of 2022. So probably a pretty aggressive timeline for many of you, especially given the holidays, the rhetoric around it right now. I don't think do you have anything else that you want to add to the OSHA one?
So the question was if OSHA applies to government entities and if DOD is under that. Yeah, they're under a separate obligation, but yes, they will be required, as will all the DCs. I believe so. I believe so, but I think it's a separate mandate, I believe. But we'll double check on that to be sure, but that's what we're hearing right now, that for government entities, it's a separate. Yeah. Okay. Yeah, we'll definitely look into that. No, I think you pretty much hit it on OSHA. Just one comment though, and I know we're doing kind of a 30,000 foot view of this, but so in terms of vaccination status with OSHA, they are saying that you will have to have proof of the vaccination and keep that roster of your employees that have either had it or not. So I just wanted to make sure that we put that out there for you guys too. As far as CMS, so what they've done, basically OSHA and CMS, they've really lined up these dates. And as Christine just said, the effective date, when they're published, probably in the next day or so. So CMS has said they're going to basically have theirs be effective starting 11/5 from November 5th to December 5th. It's like the first phase of this roll-in where people will have the opportunity to get their first vaccine. And then from December to January 4th will basically be the second phase where employees would have the opportunity to get that second vaccine. So think of it that way, kind of the slow roll-in that Christine was referring to. So with CMS, obviously all ICFs will be lumped in with that CMS mandate. The caveat here is that the CMS mandate does not include HCBS providers. However, and this is a big however, the however is that if you are an ICF and you contract with an HCPS provider, maybe for day services, those staff at the day program must also be vaccinated per your contract as an ICF. So that is where the big however comes in, as far as if you're an HCBS provider, are you scooped up in this mandate? Kind of, yes. So that's going to be the big issue. So if you have people that live at your ICF that you are, or that go to a program, maybe across town, a day program, that day program is an HCBS provider. However, with your contract, they will also be required to be vaccinated. Yeah, yes.
It is really based on, I think, the regulatory authority that CMS has. I think HCBS, a lot of the regulatory authority is delegated to the state, where ICF, obviously, that is put out nationally. And so I think it's just CMS knew that if they put this out for HCBS providers in the similar way that the ICFs were, that they would probably be taken to court and would probably lose. Do you want to add anything to that, Suzanne? Suzanne Scruton, everybody.
Thanks for having me. I think what CMS is doing is that they're very narrowly tailoring provider types over which they have authority. So I know that you think, well, it's HCBS money, it's Medicaid. It's not, it's very strict. They're just looking at provider types, and they're tying it a lot to Medicare types, provider types, except for the ICF. So anything over which they have specific authority. And, you know, if you think about it, ICFs, there's like a federal form that when you get your survey, you know, it's all federally mandated. So that's really, they're doing a really strict construction of provider types that they want to include for the mandate. And I just wanted to note that with the CMS mandate, there is no testing exception. So it's stricter. It's not as broad in some respects because, again, they're looking at just certain provider types, but there is no exception for testing.
We know that that over 100 employees, they're going to be what's coming down, right? What else reports to
CMS will ODH through, yes. And what they said that again, nobody's read the whole thing yet. I mean, we have people, you know, I'm sending questions as we speak here back to the office, but I don't think there's fines, but they will hold you in, you know, immediate jeopardy, or they do they'll do the citations. I just also wanted to point out that on Monday, Voorhees is doing a webinar on this whole topic. So it's at noon. We'll make sure that folks have the link for you to sign up. It's free. And we're talking not only about OSHA, but we're going to talk about DD providers specifically, and we're going to talk about behavioral health providers. So I know some of you provide those services as well.
Yeah, no.
Real quick, I just want to also add to what Suzanne was saying just about testing, because it's very important. What she said was accurate as far as CMS having, there is no test out option. There is still a religious and medical exemption under the CMS mandate. The difference between that and OSHA has a test out option. CMS does not. So what CMS is basically saying is you can have your exemptions, you can have your religious, your medical exemptions that you as an employer would need to decide on, but you have to figure out how you're going to handle that. What's your policy going to be at that point? Are you going to have a test out option as an employer or not? Or I'm sorry, not a test out option. Are you going to have requirements in place at that point? That's what CMS will be looking for. What requirements do you have in place for your employees? But there, like she said, there is no test out option there, but there is still the exemptions. So.
So I listened to the CMS Zoom meeting at 2 o'clock, and you're exactly right on that. But they said it could include testing. It could include physical distancing or source control, but it's back to the facility to put in what protections they would have to minimize the transmission of COVID. So if you do have the exemptions, whether it's medical or religious, and you grant those exemptions because they meet those, then you put in your own plan that you develop, and the words could instead of will or must were said by CMS. So
Definitely use the word could there, right? Okay, sure. We're just going to take a couple of questions on this. We've got other things going on, but we want to make sure we get as much information.
While the legal experts are in the room, just a question about all you hear about challenges to this mandate. And does the mandate go into effect regardless of the legal challenges, or is it temporarily the implementation halted until it goes through the process?
Suzanne didn't know we were going to put her to work today.
It depends, because as far as I know, there's not a court that has, it has made a decision on it. So we'll just have to wait and see, but I would plan on it going into effect because, the time is ticking here. So, we'll have to wait and see, but I would make plans that it would go into effect.
And Suzanne, is there a chance that in certain federal court districts, it could become upheld, or not upheld, but stop? Yeah, they could do a TPR or.
It could. I mean,
so some places, it just depends on.
It just depends on the which court it goes to and the jurisdiction. Yeah. No, it's okay. You're good. Also, I wanted to point out that there is going to be interpretive guidance issued, because as we kind of peel this onion, and we did this, if you remember back at the beginning of the COVID with the DOL regulations.
Drink.
I thought it was only going to be 30 minutes.
I don't know. Battery is lodged.
So far, we don't have anything that suggests there's a time limit on them. But again, that's probably one. Oh, yes. Bob, so Bob, are you doing this? perpetuity, shelf life. Right now, we don't have a time frame on them. I mean, maybe if everything goes back to the way it was, maybe they, take it away. But yeah, it's hard to say at this point. We could not find a time limit in there right now.
One other thing that was on the call, ICF providers on visitation, they did not touch on visitation on whether you had to do anything different on visitation to protect individual disabilities. There was also no discussion on vaccination requirements for individuals being served.
So that was, yeah, that was a lot today that got dropped on us. And we have a lot more, deep diving to do on this. And I mean, I know what I'll be doing this weekend. I don't know about you. But we will have our town hall Tuesday. We're gonna do the best we can to get as much information before then to you guys.
So with that, bad news, it's probably going to scoop in way more of you than we anticipated. But the good news is we have a full bar in North Point. There's coconut shrimp. Thank you, Melissa. So thank you all for sticking it out with us today. We really appreciate it. And we hope to see you, if you're staying here tonight, we hope to see you at 8 p.m. for our Smiles, S'mores, and Spirits down at the Edgewater Fire Pits. So thank you, everybody.